And lay on your back, head up there, feet over here. Beautiful. So pay attention to my language and how I do it. So I'm going to take you through a 10-point assessment to see how your body moves, and then we'll go through your stretch, right? So we do our regular thing, to scoop under. I'd like you to lift your knees up towards your armpit. And relax. Nice. And then I'm just checking for foot length. His legs are fairly even, right? So then I'm going to go to the other side, and then I'm just going to check your hips, how your hips move. And what I want to do in this piece here, one, is get him used to me touching his body, and two, find his ASIS, right? So I need to find those bones. Now he's super lean, it's easy to do, but some of your clients, it's not as easy to do, right? So I do that, and then I'm gonna say, now I'm pushing down on the ASIS and lifting PSIS, right? So I'm lifting up on that posterior iliac, and then I'm pushing down on the anterior. So take a deep breath in, exhale. Nice. I'm gonna give it a couple pushes to see how well that hip moves in there. And I'm gonna go do the same thing on the other side. Take a deep breath in and exhale. Now this side moves way easier than the other side. Do you feel that?
Yes, sir.
Okay, cool. And now, so AIS really quick, right? So then, and also just, this is gonna be longer than 4 minutes because I wanna teach through it. Also, if you notice that he breathes through his chest, right? He's not a belly breather. So we know that can, ramp up his sympathetic nervous system, cause a lot of other challenges. So I know when I go into stretching, I may be teaching him to breathe, which can loosen his tissues as well. But I don't tell him any of that. I just go, you notice one side's loosened, this side moves, in there. And then next, remember, roll the dough, fingers up. I'm checking internal rotation. Pretty good internal rotation. Pretty good. This side moves a little better than the other one, but fairly well. Let me know when you feel like a stretch back here. All right?
There it is.
Okay, cool. So ideally, we should be here. And you said it was here, and we kind of felt to start pulling here. Okay? Let me see this side.
Yep, right there.
Okay. Yeah. So a lot of opportunity in there. Next, I'm going to have you bend your knees. So how many did we do so far? 4 already. It's fast. Bend both knees. And put your feet together and let your knees fall like a butterfly. Beautiful. And then I'm going to stand here and I'm going to look and see, are they even? Right? So from back here, this one's a little higher than this one. And ideally we can get these thighs down to the table. Beautiful. Relax your legs. Nice. And then also I'm going to check your upper body. So first we're going to go to the shoulders. So this is like our global shoulder, And I'm going to do the same thing. Take a deep breath in and exhale. Nice. And I'm just pushing and pulling. His scapula moves really well on this side. And exhale. Moves pretty good on this side too. Nice. Next thing, I have my arms out like a T. And just bring them together, keeping your arms straight in front of you, like across your chest. Beautiful. And his arms are fairly even in there. Now slightly open your arms, make your palms fall forward, and just let it fall back gently. Ooh, yeah. So we, ideally like this can come down on both sides, and fairly even, but they don't get down, so we know a little tight through these lats in here. Cool. And then the last two, relax your arms down, sorry. I got this. I'm gonna check for internal and external rotation. So I did shoulder, I did hand length, right? I did shoulder flexion, and I'm gonna check for external and internal rotation, right? What I'm looking for, and if you need to come over here to see it, because I see this is a common error, what I'm looking for in external and internal rotation is, does his humerus stay in the joint, right? So he's here, and ideally this can come to the table. Snack crab will pop on that one. And normally when I go into internal rotation, people compensate to get internal rotation. So go ahead and just let it fall. And you see, as soon as I see this guy pop up, then I know this is where we are. Because ideally we can keep it in the joint and rotate, you feel that restriction. But ideally, we can keep it in the joint and internal rotate without the scapula coming with you. You know, so here, and then internally rotate, cool. So we got a little bit of opportunity. Ideally, this can come down. From this side, check for external rotation. So I'm at 90-degree angle, 90-90, right? And then let it fall back. Oh, this one is a little worse than the other side. And let's see this here. Okay, cool. Awesome. Good deal. And then now I can go through the stretch. Now, what did you notice in your body? We're done with this here as far as like teaching this points here, but what did you notice in your body?
It was loose, and I could tell where the opportunity was.
It was loose?
Well, I was being loose.
Okay. But what else did you notice about yourself as far as your mobility?
I have a lot of room for improvement.
Yeah, and he's fairly good. So, you know, our clients are going to see a lot of room. Now, Dia brought up something that I think may be valuable. I'm just not sure where we put it right now. To ask them, do they feel pain? So we could say, hey, as I take you through these 10 assessments, if you feel pain at any time, you know, let me know. Pain or pinching anytime, let me know. And then we can do all the same things. It's just another cue. We don't take this and put this anywhere, just to be clear. This sets them up to see like, yo, I didn't know I couldn't bring my arm back. I didn't know I couldn't lift my leg. I didn't know one arm was longer than the other. You know what I mean? And so with all those things, those cause imbalances where weight's being shifted from one side to the other side. Cool? So what I'd like us to do, and I guess we can stop. Any questions on the process before we stop? Because go ahead.
We're doing external rotation for the leg too, right?
We did it already.
I only saw internal.
Yeah, you only did it. They
Uh,
roll it down.
Yeah.
No, we did it. When did we do it?
We did the
Oh, when the butterfly.
The butterflies external rotation.
Yeah, you're out.
Yeah, we did do it. You know, any other questions? So there are 10, right? You know, so we do it. You see the way I do it? So we're not doing this. Lay on your back. We're not doing this. Lift your knees towards your chest. We don't want to do that. We want to be a part of the guide through that journey. So now I'm like controlling, lift your knees up towards your chest. I like to say armpit because I don't know where their belly is, kind of thing. And it's just a good cue. And then I come and I pull and I bring it down. Maybe a little bit of opportunity. Man, it's like I caught it the first time. You know, but that's that's the leg length or test, whatever. But we can ask him pain again is for him to see how his body's moving. It also gives you a quick thing in that 30 minutes or 25-minute stretch where we're gonna go. Like, now we're gonna do the full body. We have our 25-minute stretch, but if there was like a little bit of room and you wanted to put something somewhere, you have an idea where to do it. Cool?
Is this included in the 25-minute stretch?
No, this is a part of your assessment. So people are like, why I gotta pay $50? Well, we're gonna do our AI assessment, our on the table assessment, and you get a 25-minute stretch. Because again, this is like 5 minutes or less. And then the other side is we don't have the questionnaires to fill out. The presentation should be 10 minutes or less. So we're now at 15 minutes with the presentation and this. The keynote tech, let's say is 5, we're at 20 minutes. And they give us a 25-minute stretch. We have 10 minutes to close them, get them out, use the bathroom, be ready for the next person. All their stuff is already in the system. The close is like, hey, do you just want to use the same card on file? Yeah, sure. And typically they're going to use the card that they want charged for the assessment anyway. Go ahead.
No.
Okay. Any other questions? All right, we can stop it. And we'll